few opening remarks. Minister Costello will give a few opening remarks, and then we'll turn to some questions and answers. So kia ora koutou katoa. It's a real pleasure to be here today to announce a new childhood immunisation pilot with whānau Āwhina Plunket. I'd like to begin by acknowledging the long-standing work of whānau Āwhina Plunket to promote child health, including immunisation. Whānau Āwhina Plunket has long been a trusted, committed provider. Through the vision of Mere Hapa Riatikine, their friend and neighbour Dr. Frederick Truby King and Lady Victoria Plunket in the early 1900s, Plunket has become the largest provider of services supporting the health and well-being of children under 5 and their families. As an organisation that sees 3/4 of all new babies born each year, including nearly 6 out of 10 Māori babies, whānau Āwhina Plunket is well placed to make a real difference in those vital first 1,000 days of a child's life. During this period, immunising children against vaccine-preventable illnesses is one of the most important things we can do, and that's why it is one of the government's 5 health targets. These health targets are tightly focused on things that really matter. Alongside improved immunisation rates, we have set targets for faster cancer treatment, shorter stays in ED, wait times for first specialist assessments, wait times for elective treatment, and shorter cancer treatment times as well. Achieving these targets will be challenging, but they are an important driver and measure of change. Equally, targets alone cannot drive change. They need to be backed up with careful planning, new thinking, and new models of care. Now, over the past few years, childhood immunisation rates have been falling across the world, and New Zealand is no exception. The latest quarterly results from Health New Zealand show that 76.6% of children were immunised at 24 months. The Immunisation Task Force report, released in April 2023, highlighted that access is one of the biggest barriers to increasing childhood immunisation rates. It recommended expanding the vaccination workforce, which includes enabling all well-child tamariki ora providers to deliver childhood immunisations. And so, to support our target of having 95% of children up to 24 months being fully immunised by 2030, Health New Zealand and whānau Āwhina Plunket will pilot the delivery of childhood immunisations at select sites across the country. This will provide additional opportunities for whānau to access childhood immunisations in their communities, particularly for those who can't access primary care or where immunisation rates are low. This pilot is a way for us to test a new way of working, better leverage our skilled health workforce to support better access to quality care, and support the best possible start for our children. I'll now hand over to Associate Health Minister Costello to share more details about this pilot.
Thank you, Minister, and thank you for the lovely welcome, and to be back here again is wonderful. Tēnā koutou, it's, as you've heard, whānau Āwhina Plunket has played an important role in New Zealand for over 117 years, supporting our tamariki and whānau to get the best possible start in life. The organisation sees 3/4 of all new babies born each year. Whānau Āwhina Plunket nurses are specialist health professionals who support whānau at a significant time in their life following the arrival of a new baby. They are already supporting whānau to make informed decisions about immunisation. When I first met the organisation early this year, the main topic of conversation was how health outcomes can be enhanced by using their nationwide network of dedicated health workers, including providing immunisation. It's a natural step for whānau Āwhina Plunket to work alongside colleagues and partners, including Hauora Māori providers, specific providers, general practice and pharmacists in this area. Over the next 18 months, whānau Āwhina Plunket will be setting up services in selected sites where the need for additional immunisation services has been identified. It will become another part of the system supporting easy access to immunisation in our communities. The pilot will allow for delivery of immunisations alongside in-clinic well-child visits at dedicated immunisation clinics and community events. It's anticipated that the first site in Whangarei will deliver childhood immunisations by the end of this year. Up to $1 million of funding will be contributed to run this pilot until June 2026. This funding will support whānau Āwhina Plunket to train its workforce as vaccinators and establish immunisation services. This includes utilising existing well-child tamariki ora clinic infrastructure and networks, ensuring we're making effective use of existing infrastructure and supporting a cost-effective approach. General practice will continue to remain accountable for their enrolled populations. This is providing an additional opportunity. Whānau Āwhina Plunket will focus their immunisation efforts on areas with low immunisation rates. Whānau Āwhina Plunket will also work closely with national and local partners to connect with whānau who most need this service, to reach babies who may not otherwise receive immunisations, and facilitate effective referral pathways to ensure continuity of care. Finally, I would really like to thank Whānau Āwhina Plunket and their workforce across the country for their long-standing constructive work to support the health of children and whānau across New Zealand, as well as the many other primary and community health providers. By working together, as the Minister has said, trying new thinking and supporting new models of care, we have the best chance of achieving our health targets and with them better health and wellbeing for New Zealanders. Thank you.
Thank you. Would you like to say a few words, please?
So it's a real privilege to be standing here in front of you all today to launch our new immunisation pilots. Thank you, Minister Reti and Minister Costello. Thank you for joining us here today, and thank you for your lovely words. This pilot really is an investment in the future health of our youngest and most vulnerable in New Zealand. I would like to acknowledge the immunisation and the kahutaurima team from Health New Zealand. I know that we wouldn't be standing here today without a lot of mahi of us all working together to collaborate to get to this point. So thank you so much for your support. The passion, the compassion and the skill from our Whānau Āwhina team could not go without mention either. The work that we do every day supporting whānau to give their tamariki the best start in life is something that we're all so immensely proud of. The commitment that we've put into developing this proposal and working with Health New Zealand over many months to get to this point it really needs to be acknowledged, and I really want to thank my team for that. It's been amazing. And I also want to just acknowledge the staff who've put their hands up to become part of the vaccinated workforce. We've got a number of nurses and health workers right across Aotearoa who are really keen to help make a difference and lift immunisation rates here in Aotearoa and be part of the new pilot sites across Aotearoa. So thank you to my team for being so enthusiastic about what is a really exciting next step for us. As Minister Reti mentioned, Whānau Āwhina Plunket has been walking alongside whānau for over 117 years. For generations, our Plunket nurses, our kai āwhina, our community karatani health workers have been there walking alongside whānau to support their tamariki to have the best start in their lives. We're passionate supporters of the Minister's target of 95% of up to 2-year-olds by 2030 being fully vaccinated. And our role every day is to support all things child-related, and one of those has been to educate whānau around immunisations and to support with referrals for that. We see firsthand the toll that preventable diseases have, like whooping cough, like measles, on our youngest and most vulnerables in communities. So for us, we see this as a really natural next step for our workforce, for our Plunket nurses to become vaccinators and help to be part of that solution. We're trusted by whānau. We are welcomed into their homes. They come to us in our clinics like the one we are here today, and we meet in communities and spaces and places that they feel safe in. So it's really exciting for us to be another option for whānau to be able to access vaccinations. We, as the Minister has mentioned, we are going to be focusing on areas where it's harder to access general practice, or where immunisation rates are lower and where we have the facilities to be able to help support. We're going to continue to be working really closely alongside our hauora Māori providers, Pacific providers, general practices and now pharmacies as well. We know that we can make a real difference and play a real part in the health system's efforts to improve immunisation rates for Aotearoa. We've got a really busy time in front of us though. So over the next 18 months, we will be setting up to 27 pilot sites across the country. And again, in those places where we see gaps, and we will be working really closely with the communities, both nationally and regionally, around ensuring that we identify where those gaps are and work collaboratively to do that. We're really looking forward to starting our first site, which is in Whangarei. We want to have that up and operational by the end of this year, which is really exciting. And the team are really excited about being part of that. It's a great team that we've got there. So over the next few months, we need to invest in things like getting our cold chain set up, making sure that all our teams are trained and upskilled and approved as vaccinators. And we've also got a number of nurses who are already vaccinators, so it's great to be able to leverage their skills and capabilities into the mahi that Whanua Whina Plunket does now as well. Further on down in the pilot, we're also really hopeful that we can also upskill our kaya whina and our community karatane health workers to be part of the immunisation workforce as well. So that's really exciting for those teams too. But for now, I would like to say a huge ngā mihi nui to everyone who has worked really, really hard to get us here today, as well as to my team, just for every day the mahi that you do supporting whānau and tamariki to thrive. It really does take a village, and we're all part of that. So thank you so much. Now, just one thing before I do finish, we do have a couple of little helpers here somewhere, I think, little Noah and August, who might have a little gift for Minister Reti and Minister Costello. Thank you so much for being here with us today. Let's see if they're brave enough to come on out.
They're hiding.
They're hiding. We might have to do that off camera.
All right, we can cover that.
We can.
We'll come to that. We'll let the children eventuate as they eventuate. Look, this makes sense. As many as 80% of infants and young babies make contact with Plunket in the first 12 months of life. So to be able to have this access available through people who are already making contact with these young babies just makes a lot of sense. We're really pleased to be able to bring it together in that collaboration, as you say, that joint working of all the teams that have brought us here today, where we can make this work for a really important target. So thank you for that. And with that, we're happy to take any questions, both Minister Costello, myself, Plunket, or any other domain experts we may have in the room.
Minister Reti, how much will this pilot actually increase the vaccination workforce? Like how many people are going to be trained up?
So that is something that has been modelled out. Obviously, it'll use existing workforce that Plunket currently has. Are you envisaging new workforce as well?
No, our first focus is upskilling our existing workforce. Now, these are pilots, right? So we're talking about up to 27 sites. This is about testing different models and new models of care. And so we will establish that as each site is identified, and we work towards those goals.
And you said the first one was in Whangarei.
Correct.
Where else are you looking to set up these pilots?
So that will be worked on a quarter-by-quarter basis in terms of identifying which regions, but by March next year, we are hoping to have Kirikiriroa, Taumanui, Whanganui and Kaikoui set up by March, and then the others will be established as we work with the teams in the local communities.
You talk about the falling immunisation rates. I mean, is the workforce really the key issue here, isn't it? In a lot of cases, the parents just don't want to get their kids vaccinated.
Look, it's a combination of things. It's multifactorial, and it's not just unique to us here in New Zealand. Across the world, immunisation post-COVID has been a struggle. There's been that increase in vaccine hesitancy. And so it's a combination of persuading parents and ongoing education that it is safe, that they are vaccine preventable, but it's also access and making it easy for people to do the right thing. They want to do the right thing. How do we make it easy? And part of that has been enabling pharmacists, enabling midwives, all those places where people may go with their young children. How can we have skilled professionals in those places to give vaccines? So multifactorial, a combination of things, but yes, it also includes winning the trust and support of the caregiver. That's correct.
Just speaking about workforces, this morning the Senior Doctors Union told RNZ that Health New Zealand is proposing to cut the number of chief medical officers from 18 to 14. Mm-hmm. Is that in keeping with the government's commitment not to cut frontline staff?
Yes, it is, because the number of clinical full-time equivalents will not substantively change, is what Health New Zealand have assured me. And while some of the chief medical officers or chief clinical officers may change, there are new positions for maternity and new frontline positions for mental health and addiction.
There's concerns that it'll disadvantage regional patients. Do you share those concerns?
No, I don't. Quite the opposite, particularly since we've pushed out regional deputy chief executives into the 4 regions. We are regionalising and taking healthcare closer to the home, closer to the hapu, just like Plunket are here now, closer to the home, closer to the hapu.
So what assurances can you give people in the regions that they're having, sorry, I'll start again. What assurances can you give patients in the regions that are having their chief medical officers cut or merged? That's South Canterbury, Wairarapa, the West Coast, Whanganui, Lakes and Bay of Plenty.
That their clinical needs will still be serviced by the existing reconfiguration, and that new clinical roles will be created.
Māori vaccination rates, just back to vaccinations in particular, are very low. How will this support Māori communities?
A number of things, and I'll ask Plunket to speak to that as well, but a couple of things. First of all, I generally think of that delta between Māori and non-Māori as about 10%. Sometimes it's more, sometimes it's less, but definitely less. If we look at the initiative we brought out before Christmas, which was very focused, $50 million focused on Māori vaccination, and what that was doing was using the existing mechanisms, the Hauora Māori providers that we have, because they will go and they can do what mainstream cannot and will not. And so that $50 million was specifically directed out to rural, remote and vulnerable communities. When they get there, they actually service a universal audience. Okay, so they will service Māori and non-Māori, but they've got the networks to get out there. Furthermore, the first 6-month target was 10,000, and in fact, one of the lead providers delivered 33,300, so well in advance of target. So we do have specific Māori immunisation mechanisms, but I'm sure Awhina Plunket as well.
Yeah, absolutely. And for us, we see over 75% of all tamariki in New Zealand, 60% Māori whānau. So that's an important demographic for us as well. When we talk about focusing on the communities that have low immunisation rates and where we need to help be part of that solution, that's where we're targeting. So this isn't a blanket approach for us. We're being really targeted about the pilot sites that we do identify, and so being sure that our Māori whānau are part of that will absolutely be part of those areas that we're identifying.
You talk about the size of the workforce being one aspect to improve vaccination rates. What else is this government doing to try and improve those rates?
So there was a number of recommendations, 54 actually, from the immunisation task force, and I won't go into all of them, but substantively they are around how do we make access easier for people. How do we have enough vaccinators that are credentialed to provide safe vaccination? How do we make it easy, as I said before, easy for people to do the right thing? I fundamentally believe that people mostly do want to keep their children safe. They mostly do want to vaccinate their children. So in busy lives, how can we provide opportunities, be it in clinic, be it in pop-ups, be it in events? How can we go to them if they're struggling to come to us? That's part of what this collaboration is about.
Minister Costello, just a few questions from a colleague. You got independent advice regarding your changes to taxes for heated tobacco products. Who gave you that advice?
Oh, that's all been released. I think I'd rather be focusing on the issues we hear today, which is to celebrate the work the Plunket are going to be doing. But that's all been fully disclosed and released.
Were the documents provided to your office by a third party?
Yeah, again, this has all been released. It's publicly released. All the information's been provided under OIA, and that information's readily available from my office.
It didn't come from the taxpayers union?
No, it did not.
Just on that, the documents have been released, but the actual advice hasn't. Are you planning on releasing that?
So I think we've got to step back here again. I wanted to focus on Plunket here today, and I think it's unfair for this organisation to be dealing with smoking issues. What I can say is that there's a program of work to achieve smoke-free 2025, and we're committed to doing that, and I'm happy to talk further away from this venue if you want to discuss it further.
Finally, why did you want independent advice?
Well, you get a range of advice on every policy decision that's taken to Cabinet.
Minister Reti, in
Yes,
terms
Isaac.
of Health New Zealand's financial position, take some ownership of that, given it's still running deficits in terms of the position it's found itself in now?
I'll own from the time we came into government and I received my warrant, but you better be darn sure the previous government needs to own everything in front of that.
And how much of it is a priority for you that Health New Zealand is running a surplus or is breaking even? Is that
Absolute priority for me, absolute priority for the government, that we return to break even, that we return to financial and fiscal stability.
Do you think you can do that without causing any more pain? We get a lot of reports from hospitals and specialists that are already cutting quite deep, looking at possibly $2 billion in reducing funding. Can you do that?
Look, I think it would be naive to think it won't be challenging, but I'm also very encouraged by several things. First of all, a 3-year vote health appropriation, which we've never had before. Secondly, $1.4 billion of new money just in this financial year. So I am encouraged by that, and I am encouraged by the leadership that the Commissioner and the Chief Executive are showing as we look to turn this around. So yes, it will still be challenging. We all accept that, but I do have faith that we can achieve the goals that are being set.
So on the primary care issue, do you have any update on the funding of primary care and around the capitation funding and so forth and the work that's been done?
No, look, that's still a work in progress as to how we can better align capitation funding to where the work is done, to where the morbidity is. That's quite complex. Obviously, we don't start from scratch. Superior Report 2022 outlined a range of attributes that might link to exactly those sort of discussions. We're continuing to progress it, have been working on it for a while.
The Ministry's latest bulletin warned that we are at a high risk of a measles outbreak. How concerned are you?
Absolutely agree. I agree with Michael when he says that a measles outbreak will be when, not if. And we've done substantial work to be prepared for a measles outbreak. Again, it would still be challenging if it came to us. And imagine from where we are today, if we go back to 2019, to the last measles outbreak, by the grace of God, we didn't have a death in New Zealand. Not so good in Samoa, 83 to 84. Yeah. Today, we're now at least 10% below our MMR rates to where we were in 2019. How do you think that's going to go for us? Probably not so good, which is why we're working with Plunket and with others to try and lift those rates. So yes, I am concerned, particularly with measles. I'm increasingly concerned with pertussis or whooping cough as well, by the way.
How realistic is it that you'll hit that 95% target, and do you set interim targets along the way?
Yes, we do. We'll have milestone targets on the way. That's going to be hard. That's a hard target. We got close in 2007, I think. We may have been around about 93%. It's a challenge across the world, but that's not a number picked out of the year. That's the herd immunity target. And so we want to head towards herd immunity.
Just going back to the finances, sorry, did Health New Zealand miss the warning signs to stop this deficit from getting to where it is?
Yes, and I think Margie Upper, CE, has recognised that, as has the Auditor General in their report last year, in their report April 9 this year. They said no one was watching, no one was monitoring. Where was the internal performance monitoring framework? Where was the operating model? And everyone is now acknowledging that it just wasn't there. No one was looking.
So should government have known that nurses' spend was to meet care capacity demand management requirements, and should they put in more funding?
What they should have done is they should have been monitoring the increase in recruitment against budget. Again, no one was watching and no one was looking. Whether it's the CCDM or whatever that is, it was against budget and it was too late before that was picked up.
So given that the forecast turned from a surplus to a deficit so quickly, do you regret questioning the board's financial literacy?
No, because at the end of the day, the board had first visibility on the financials. They then had obligations to report to me, to report to Treasury, and to give some visibility as to what the issues were. Again, there weren't procedures in place to watch and monitor.
Fiona, you hear from a lot of parents. I mean, what is the main thing that they're telling you is the barrier to getting these vaccinations, or what are the key barriers parents are facing from what you guys are hearing to getting these immunisations?
I think that's really multifaceted, right? So it's it's different for different families. Some of it is about access, so access to GPs. It's really difficult in some communities where books are closed. There could be transportation issues, people not actually able to get into clinic, and then there is what we've already talked about as well around people actually that. Vaccine hesitancy, and so part of our role and has always been around educating and working with whānau around talking about vaccinations and immunisation and why that's so important. We will continue to do that. What we now have the opportunity to do is also be able to offer a vaccination as an option for whānau.
Minister Reti, just a couple of questions on Kinapuru Hospital in Porirua. Is it acceptable that they have to provide telehealth services instead of staying open 24/7?
Oh, look, it's always a challenge. Wherever we have workforce shortages and we have a telehealth option, for example, like ka ora, out in the rural environments, it is always preferable to have person-to-person, face-to-face. That is not the situation we find ourselves in, and so it is a temporary measure until we can build that health workforce. So no, it is not ideal, but it does provide some mechanisms for after-hours care.
So with that in mind, have you asked Health New Zealand to find staff for the hospital? So
Multiple times.
And what is that? What are they saying?
Exactly what I said. It is hard to find health workforce, and that telehealth has a role, not just at Kinaperu, but in other places as well. But I'd also say, if you look at Kinaperu, take the Signal. They have a brand new X-ray machine, which is a signal that we're still backing Kinaperu. So take the Signal. We're now just working on the health workforce that goes with that. Good. Well, if that's all, thank you very much. We'll make our way, see if we can find these children or
Yes,
whatever
yeah.
we're doing next.
We'd love to invite you to stay for a cup of tea, and we
Sure.
can show you around the facility. And
Cool,
yeah.
cool. And remind me, media welcome to join us, or what is the
Yes,
policy?
yep. Welcome
Okay.
to join us.
Okay, just
Yeah.
just do the right things,
Absolutely.
folks. We know children on camera and all that sort of stuff, please.
Yes.
Okay.
Yeah.
Okay.
Great. Thank you.
Good stuff.
All right.
We'll follow you then.
Thank you.